In medicine or health, many things that we measure need to fall within normal ranges, meaning they're not binary. They're not necessarily they're there or they're not. And this applies to orthopedics as well as other medicine. If you go get your blood drawn and just do the standard CBC or CMP, you will see on the right side of that page the ranges, and you can fall within different parts of that range and still be normal for you. The same thing applies in orthopedics. Outside of structural competence, which can be more binary, but not necessarily, then we are dealing with ranges. We're dealing with ranges for joint range of motion, muscle strength to a smaller extent, muscle flexibility, and nerve extensibility, and in other categories of orthopedics as well. Where I think this really kind of makes the most impact is when we talk about joint range of motion and the normal variability there. A knee in some person may have extension of -2 degrees, in another person it might be -10. Hip internal rotation can vary widely. Spinal movements especially can vary quite widely. We do adjust for age, or at least I do when I approach a patient, but even within the same age group, you can see widely different numbers. Someone's neck may rotate 35 degrees, another person's neck may rotate 45 or 55 degrees. And the point I want to make about ranges is that if someone falls within normal, but we don't know if it's contributing to their complaint or actually normal for them, the clinician's job is to figure that out. And we figure that out with investigation. A lab technician, for example, that's not his or her job. Their job is to report the number. But a clinician's job is to take that number and ask his or herself, is this normal for this patient, given all the other data that I've collected? If I do a patient evaluation, I'm collecting probably between 20, 30, 40 different data points. So knee extension range of motion on the right could be one, knee extension range of motion on the left could be another. The quality of it on both sides could be 2 more different data points. So even just there, we're getting 4 data points. And so it's not hard to imagine that when there's a verbal history, when we're looking at the entire lower extremity and the lumbar spine, we are going to get lots and lots of pieces of data. So by getting that, by contextualizing range of motion within that picture, we can start to figure out if someone has -2 knee extension, but their other side is kind of -8, and we think that's relevant, we can start to ascertain if it is or not by doing clinical testing. I rely heavily on repeated movement testing. I think it's the most valuable orthopedic test there is, and not many clinicians use it. But it helps me algorithmically basically answer that question. Is this the normal for that patient or not? Now, in the example of knees, obviously you have a right and a left, so it's easier to kind of predict that if you're missing 6 degrees on one side versus the other, it's probably relevant. It's probably, even though -2 falls in within normal range of motion for the population, if your other one is -8, it's probably not normal for you on that side. But we need to invest, like I said, kind of cause and effect algorithmically and figure it out. When it comes to the spine, of course, it becomes trickier because you don't have 2 low backs. So we can only compare you to you. But by collecting lots of different data points, if I'm starting to think, well, your range of motion is normal because there's a wide variability in normal lumbar flexion, for example, but it's on the low end of normal, and I really think you need to have on the high end of normal, I think you've lost several degrees over the last weeks, months, years, or decades, then we need to consider it part of the pathology that we need to address. If you think of TSH and the thyroid, for example, someone may feel perfectly fine, have other biomarkers that are great with a TSH of 4, but another person may have a TSH of 4 and have symptoms, have maybe T3 and T4 are off. And so the clinician's job is to figure out, okay, it's in the range, but it's not good for you. That's why we have a range. So we need to play around with different investigations, different interventions, maybe dietary, maybe supplements, maybe prescription drugs, and see what happens to those metrics. And it's the same in orthopedics, although the intervention I can provide primarily is movement. So if I think you're lacking movement in your lumbar spine and flexion, for example, and I think that's relevant to your hip complaint, then I want to investigate, let's see if we do this to your lumbar spine in a specific way, if we get more lumbar flexion and the hip complaint gets better or worse. Interpreting normal ranges of motion is a really big part of a clinician's job in orthopedics, not only range of motion, of course, but also how far nerves can move, how strong muscles are, how much muscles can move. But you need to be prepared to investigate to see if that's normal or not for you, because just taking a snapshot of range of motion, for example, of how much your hip rotates internally is not telling you much. You have to take it in conjunction with all the other data points and then do the investigation to find out, well, if we do this and we get more range of motion, does that change the complaint or not? Or if we do this, does the range of motion decrease? You have to be willing to investigate, kind of play around and try to figure it out, because if you don't, you're just going to be making assumptions and it's going to be harder to get to the root cause diagnosis and therefore harder to find an effective match treatment.